Hi, my name is Catherine Hubbard, and I'm going to be discussing borderline personality disorder and what are viewed as effective treatments. So, individuals who have borderline personality disorder are commonly faced with challenging interpersonal relationships, negative self-image, and impulses. For someone to actually have a diagnosis of this disorder, they need to have at least 5 of the possible 9 criteria points listed by the DSM-5. Sometimes these individuals have a fear of people in their life leaving them. They express feelings of extreme hatred, extreme love. They tend not to think highly of themselves and can engage in binge eating, dangerous driving, speeding, sex, things that can be viewed as impulsive. So this is not only present in BPD, but it's also common for these patients to have suicidal ideations. They have a lot of mood swings, can have intense anger at times when you may not understand why, or when it might not be appropriate, or it doesn't seem to have a reason. And also stress-related paranoia or severe dissociative symptoms. So when things are just too intense for themselves that they can't fully be present in the moment and end up creating false thoughts and false realities. People who are suffering with BPD, common treatments can include mentalization-based, dialectical behavioral-based, transference-focused treatments. All of these are used to treat individuals who have borderline personality disorder, and although there is some debate against which treatment is best for those with this diagnosis, I think it's an important thing to note that getting any treatment is going to be better than receiving none at all. And anybody who is experiencing these types of symptoms like mood swings or paranoia, abandonment, fear of abandonment, impulsivity, or any of those symptoms which were listed on the previous slide, is important to receive some kind of treatment. The first type of treatment that I'm going to talk about is MBT, or mentalization-based treatments. This kind of therapy really looks at the patient's mental state and trying to help them better identify their own emotions. It's also known to benefit symptoms of something called alexithymia, which is when you're unable to identify your own emotions or properly express them. One study done by Loyoff, Clinton, Kalido, and Radin, if I'm pronouncing those correctly, looked at naturalistic outcomes. The study actually took place in Sweden at Hodgkin University Hospital, and it took place over 18 months. Individuals who were in this particular study took part in both group treatments and individualized treatments. And it was interesting because people who walked into this type of therapy, being MBT, started having really negative images about themselves before they came in. And when they left, they found that they were able to identify more with self-love and had a lesser tendency of self-attack or butchering their own thoughts or making themselves feel too horrible. What's kind of interesting about this specific study is that it was found that patients who suffer from BPD, when using this mentalization-based treatment, are able to get sufficient treatment on an outpatient basis or through routine mental health care. When you compare this to something such as dialectical behavioral therapy, it costs about double the amount to complete a session, and it also takes double the amount of time to complete a session. So this is obviously the most cost-effective and seems to be one of the least time-consuming. Next is TFP, or transference-focused psychotherapy. This looks at internalized relationships with the self and with others. This actually comes from the Freudian school of thought, or Freud's psychology, where transference is described as the belief that individuals can project how they feel onto other people. So specifically in a therapist setting, thoughts and emotions and these feelings that an individual are having is put onto the therapist. Where this therapy seems to, in theory, make sense is where we can see that it's looking at internalized relationships with the self and others. We know that people who do suffer from BPD tend to have challenging interpersonal relationships or fear of abandonment. So being able to internalize and seeing both sides, in theory, makes sense as a treatment for this disorder. According to a study by Kernberg, Yeoman, Clarkin, and Levy, again, apologies if I'm saying the names incorrectly, in a clinical setting, this therapy rather, not only benefited patients who were having suicidal ideations, but it also helped with physical health. And patients who took part in this therapy no longer met the actual criteria for borderline personality disorder, which in itself is pretty remarkable. Lastly, I'm going to discuss DBT, or dialectic behavioral therapy. This form of therapy is a combination of cognitive therapy and the Buddhist practice of mindfulness. It connects the inner self and ways to better self-efficacy, and it definitely appears to be the most researched of all forms of therapy to benefit borderline personality patients. It has a higher success rate than cognitive-based therapies, which could be because of its combination of mindfulness and the traditional form of cognitive-based therapy, and is definitely less expensive and less time-consuming than TFP. In one particular study, 70 participants took part in DBT group and were asked to use their skills which they learned in dialectical-based therapies. So those patients who actually used the skills that they learned through their therapies were more likely to engage in positive self-behaviors and less likely to behave in self-harm behaviors. And those who did not participate in their sessions and did not apply the skills that they had learned had a higher likelihood of not stopping their self-harm behaviors and continuing on with their practices. So what this is showing us is that when people actually apply the skills that they learn within this type of therapy, the success rate is considerably high. Whether a patient of borderline personality disorder takes part in dialectic-based therapies, mentalization-based, or transference-focused psychotherapy, benefits come from receiving treatment. And I think that is something that's significant and really important to take into consideration. Thank you guys for listening to me today, and I hope that you learned something and enjoyed learning about borderline personality disorder and its effective treatments.